I'll just do a brief introduction, if that's okay, Maya and Anna, just to kind of set the scene, and obviously welcome our colleagues as well. If We'll continue to admit people as well as I'm doing that. Um, so Good evening, everyone, and first of all, thank you for joining us. I'm Rajshri Owen. I think I recognise a lot of the names, or all the names to be fair, and I'm the Chief Officer for Community Pharmacy Leicester, Lewisham, Rutland. So on behalf of Community Pharmacy Leicester, Lewisham, Rutland, I'd like to warmly welcome you all to tonight's Breast Cancer Now Train the Trainer pilot webinar. And let me just admit people, sorry, I'm kind of doing a little bit of both. So if you do see anybody that needs to be admitted, you can just let them in, Maya and Anna, if that's okay, whilst I just walk
sounds
through
good.
this. We really appreciate you taking, first of all, the time out of what we know is a really busy schedule and to join us this evening. Just to set the scene, and you all work in community pharmacy and you're part of community pharmacy teams, and we know that you all play an incredibly important role within our communities, and often, we would say that you are the most accessible healthcare professional supporting patients not only with medicines but also with prevention advice and early health conversations as well. And that's why initiatives like this are so important. They provide an opportunity for pharmacies to further strengthen their role in health promotion and also early awareness, helping people and patients understand their health and access support at the right time. So this evening, we're delighted to be joined by colleagues from Breast Cancer Now's Public Health, Inclusion and Awareness team, who will introduce the Train the Trainer Breast Health Promotion Pilot in Leicester. It's a short session, so this session is only a 30-minute session, and during that time they're going to walk you through the programme, explain the support available to participating pharmacies and outline how you and your pharmacy teams can get involved. There'll also be time at the end for you to ask questions, so you can explore whether this pilot is something that would work well within your pharmacy. Now, breast cancer awareness and early detection remain hugely important public health priorities, and community pharmacy has a unique opportunity to support this work at local level. So again, thanks for joining us this evening. I'm going to now hand over to our colleagues, Maya and Anna from Breast Cancer Now, to take us through the programme. Over to you.
Thank you so much for the introduction. And yes, thank you so much for being all here today on this lovely Tuesday evening. We really appreciate your time. My name is Anna Preciado, and I'm the Public Health Development Manager at Breast Cancer Now. And I'm also delighted to be here with my colleague Maya to talk to you about our Train the Trainer program piloting in Leicester. So in this session, we're going to walk you through the program, the support available for participating pharmacies, and how you can get involved. We'll also have some time for questions at the end so you can see if it's the right fit for you and your team. And just before we dive in, I'd like to briefly introduce who we are as a charity in case you're not familiar with us. We are Breast Cancer Now, the UK's largest breast cancer charity. We're here to make sure that by 2050, everyone diagnosed with breast cancer lives and is supported to live well. And we do this by several things, such as funding life-saving research, campaigning to ensure people affected by breast cancer receive the best possible treatment and care. And we also provide a wide range of support services for anyone living with or affected by breast cancer. May and I both work in the Public Health Inclusion and Awareness team, and we support in the development and delivery of the charity's public health programs. And a key part of our role is making sure these programs address health inequalities and are inclusive and representative of the communities that we serve. I also just want to take a moment to highlight why this work matters so much. Breast cancer is the most common cancer in women in the UK, and around 1 in 7 women will develop breast cancer in their lifetime. And at the moment, a woman is diagnosed every 9 minutes and a man is diagnosed every day. So that's about 55,000 women and 400 men diagnosed each year. And unfortunately, if nothing is done, by 2040, a woman will be diagnosed every 8 minutes, and we could see nearly 7,000 women diagnosed annually. And just to add, in terms of breast cancer mortality, every year, 11,500 women and 85 men unfortunately die from breast cancer. That means that someone loses their life to breast cancer around every 45 minutes. So again, we're really talking big, big numbers here. So our trainer aims to improve awareness and promote early detection of breast cancer. The aim is to train local healthcare professionals and allied healthcare professionals on breast awareness, breast screening, and risk reduction. Therefore, trainees will be equipped with confidence, knowledge, and resources to confidently share these messages with patients and their communities via one-to-one conversations, talks, or potentially patient education events. So how did we choose our pilot sites? So we're currently running this pilot, just so you know, across 4 areas in the UK, Lanarkshire, Glasgow, Leicester, and Westminster. And the reason why Leicester was chosen, well, I'm going to walk you through some of the reasons why. In 2024-2025, breast screening coverage in Leicester was just 53.2%. And if we compare that to the national average for England of 70%, we can see that it's well below that. And also, if we compare that to the neighboring Leicestershire, which is 72.9, we can see again that Leicester is quite below that national average and the Leicestershire average. We also know that Leicester is, again, the lowest performing area outside of London. And this is really, really important because breast screening is currently one of the most effective tools we currently have for detecting breast cancer early, offering women early treatments and better survival rates. And we really want to make sure women in Leicester are attending their screening when invited to give them the best possible chance. But it's not just about screening rates. So ONS data also shows high levels of deprivation, ethnic diversity in Leicester, and we know that these factors matter. So Black, Asian, and minority ethnic women are often less aware of the signs and symptoms of breast cancer and less likely to check their breasts regularly, and also less likely to attend breast screening. And the result of this is that they're more likely to be diagnosed at a later stage when treatment options are more limited and outcomes are poorer. That's exactly why we need, and we'd love to have you involved in this exciting project. And by working with communities directly, we can make sure that key messages about breast awareness, breast screening, and risk reduction reach the people that who needs them the most. And one important note before we move on is that we are currently piloting this program in Leicester. That means that if you don't work with Leicester residents, you may not be able to qualify for this training. This is because we're working with an external evaluator to assess what's working, and that requires focusing in on a smaller area. But if you have any questions about your eligibility or want to find out more, please do contact us after the webinar and we'll be able to answer any questions. So, how is training delivered? We are currently offering 2 ways to complete the training, and both are completely free of charge. First, we have our live online workshop, which is delivered over Teams, usually from 10 a.m. to 2:30 p.m. So that's approximately 4 hours of training. And we also have our self-directed e-learning option, which is available to complete at a time and space which suits you. This format takes approximately 2 hours to complete and has been a very popular option. It has been the most popular option among those in health and care roles. Though both delivery methods are interactive, they're engaging and cover what breast cancer is, breast awareness, the importance of early detection, the signs and symptoms of breast cancer, some of the risk factors and common myths, information about the NHS breast screening program, and lastly, developing an action plan to share these learnings among your patients. So we really cover a lot. And it's also important to mention the focus of Train a Trainer is not only on building your knowledge around breast cancer, but as well as how to have confident and supportive conversations with people in the community about breast awareness, breast screening, and risk reduction. So for some pharmacists, talking about breast health can feel sensitive, or maybe it's a difficult topic to introduce. So the training aims to give you the tools to approach the topic in a natural, respectful, and supportive way as well. And another important part of the training is understanding why some people may not attend to their breast screening appointments. There can be many reasons for these. For example, lack of awareness, cultural beliefs, fear, embarrassment, language barriers, accessibility issues, among many, many others. And during the training, we explore these barriers and discuss practical ways healthcare professionals can help break them down when speaking with patients and members of the community. In summary, the overall goal is to help you feel more confident about raising awareness, encouraging conversations about breast health, and supporting people to feel more comfortable checking their breast and seeking help if something changes and attending their breast screening if invited. So I'm going to now hand over to Maya.
So, what are the benefits of being part of our Train the Trainer course, and how can Breast Cancer Now really support you after the training? So, firstly, everyone who completes the training will have access to our healthcare professionals online hub. And as a member, you can access our library of webinars to support your CPD and sort of professional validation. You will also be able to order and download a wide range of publications and resources to support community engagement, including some publications in different languages and some in easy read formats. You will have ongoing support from the Breast Cancer Now team, whether this is help finding a specific resource, signposting a patient or a service user to a specific group, or assisting in answering a query. You will also be able to apply for a small grant, which is designed to support local activity and message sharing. So each trainee on the programme will be able to apply for up to £1,500 to help fund things such as translated resources, awareness materials, posters, or even money towards community events. There will also be opportunities to attend future events to develop your knowledge, skills, and engage with other trainees and share best practice. And lastly, you will receive a Breast Cancer Now certificate of completion. So, why are we here today and why are we sort of so keen to get the community pharmacists involved? So we really feel that community pharmacies are trusted, they're accessible, and you're really uniquely placed to share really vital breast health messages and encourage women to check their breasts regularly and attend screening. As Rajshri touched on earlier, you're often the first point of contact for people in the community, including those who may not see a GP or engage with other health services. And that's the sort of woman that we want to be reaching with our messages. And I just think it's important to note here that we, of course, understand you're busy professionals. So it's really important just to get across that we're not expecting you to have any super long or dedicated or lengthy conversations. It might be as simple as pointing to a leaflet, mentioning more about local breast screening, or saying a few words while someone waits for their prescription. The hope is sort of by sharing small nuggets of information, it could be the nudge that someone needs to check, to book, or to seek help sooner. And that's also why we're inviting trainees from a range of roles. So community pharmacists, pharmacy technicians, pharmacy teams, sort of anyone that works in that environment and is having that engagement with the community. A few other details from me. So training is being offered until the end of July this year, so there's still plenty of time to get involved. And the ongoing support and benefits, which we mentioned earlier, will be available until July 2027. So we really want to reiterate that we are here to support you. And then just quickly, sort of expectations. After the training, we ask that you just aim to engage with people in your community regularly in a way which suits you. We don't want to be super prescriptive. We're not telling you to share the information in a certain way. It's whatever works best for you. And we also just ask that you support the evaluation of the pilot by completing short surveys. And that's the end of our presentation. Thank you all again for coming along and for your time. If you have any questions, Anna and I are here to answer them now. Or if you need to head off or you want some time to think, please feel free to drop us an email on the screen, and I'll also put it in the chat. But yeah, open the floor to any questions if anyone does have any.
Thank you both, Anna and Maya, for that wonderful presentation and synopsis of what it is we're trying to achieve. If you have any questions, feel free to pop it in the chat or raise your hand as well. That would be great. There is a comment by Geeta, is better stall covers. I'm not sure what that means. Geeta, unless that makes sense to you, Maya or Anna, but does it make sense or is it clear? If not, Geeta, can you maybe just clarify what it is that you're asking?
Geeta, is that around the ground? Like if stalls maybe are covered by the ground? Am I correct in understanding that?
Geeta, can you clarify what you meant in your question or comment in the chat? You can pop yourself on unmute. Oh, okay. Sorry, yeah. Does that cover Birstall? So it's more about geography, because obviously Anna alluded to in terms of the eligibility criteria. We've obviously got community pharmacy owners on, or we have some community pharmacy owners on the call as well. And so it's more about, does the pharmacy have to be located in Leicester itself? Because what we know is that patients don't actually work to any boundaries. So you can have a Leicester patient go into Leicestershire or Rutland or even into Nottingham for work or whatever purpose. So the question is, does the pharmacy need to be located in Leicester itself, or is there a postcode in terms of that eligibility?
For this particular case, because Birstall is so close to Leicester City, it would apply, and they'll be able to be part of the program and take the training. It just really depends again, yeah, on where we don't have a super defined kind of like geographic boundaries, but we do have to consider a certain boundary. So I think it'll be really case by case. So the best thing that I can suggest is really just send us an email of where your pharmacy is located, and then we'll be able to let you know if you're eligible or not. Just reading, is Loughborough covered? I think it is, but let me just quickly check.
Thanks,
So
Anna.
that one's actually a tricky one. I might have to get back on that one, but do send us an email, Suhail, and I'll be happy to talk to you around what we can do and if we can accept that pharmacy to be trained.
Okay, so if you email trainthetrainer@breastcancernow.org with your pharmacy pharmacy premise address, Anna and the team can then take a look at it, because it is a pilot, so you're not that prescriptive. It's more about patient needs in those specific areas by the sounds of it. Okay, understood. Rahul's got his hand up, so can I just bring Rahul in?
Hi, is there an actual list of the eligibility criteria, or is it just, do we have to email and then you're deciding what do we need to write anything else apart from our location and pharmacy name?
Yeah, if you wanted to enroll, really the only thing that it's we ask for you to be eligible is that the pharmacy or you interact with people from Leicester, and the second one is that you share these messages with your patients, and you fill out the service. But other than that, there's nothing else really that we need from you. So how the registration process works is you send us an email, we just chat you, we get some details from you, and then you get we're going to be asking you which delivery method you prefer. So we have some dates already in the calendar for the online session, so we'll be sharing kind of like those dates to see if one of those work for you, or otherwise if you want to do the self-directed, we then enroll you just by asking again a few details, and then we give you some instructions. And then also something that we haven't mentioned is that we do have the ability to send you some physical copies of our workbook and our information book, which is part of kind of like the training. So you can have those as well if you're happy to receive them and provide us with an address.
Thank you. Also, with regards to once we've done the training and You said there's a grant. Do we need to use the grant ourselves and come up with our own resources? For example, let's say we're looking at ethnic minority population. Do we have to translate information and put it on, or have you got let's say PDFs and posters, etc., that you help, and do you help with any of those resources?
Yes, absolutely. And we do have a few resources. So we have a mini guide that is it's a kind of like breast checking mini guide, and that's available in 16 languages. We also have other resources such as videos. I can't remember how many languages that's translated into, but we do have a lot of resources that we can share with you. And again, you could also use the grant for creating your own multimedia resources and yeah, but we would be able to provide you with that. And also, for example, if you wanted to request some, for example, get some pens with the TLC touch look check, which is our breast awareness campaign, we could also provide you with that. So again, we can support you in many different ways.
And just jump in. And you don't have to use the grant. The grant is completely optional. But as Anna said, if you needed to use the grant for translation services, it can be used to cover that. But yeah, we do have a lot already, so we can work with you after the training to provide those to you.
Thanks, Rahul. Any other questions from anyone on the call? And just back to the grant, if that's okay, Maya and Anna, if a pharmacy was to participate in the pilot, they would need to, they don't necessarily have to apply for the grant. Is that right? Yeah. Okay.
Yes, the grant
it's
is just an
optional.
extra.
Yeah.
Yeah.
Okay, understood. Okay, perfect. Any other questions from anyone on the call today? No? Okay. So what I'll do, Maya and Anna, I will, if you can just share the slides with me. I don't know if you are able to, but I've obviously recorded today's session. I'll circulate the recording with all of our contractors who, for one reason or another, haven't been able to join this evening, along with the slides, and also reiterate the email address in terms of if they have any further questions as well. Yeah, I think unless you've got anything else to add in terms of any further information for community pharmacies that are on the call.
No, just that if you think you're interested, yeah, and unsure if you meet the eligibility criteria, please just drop us an email, and we're happy to have a conversation.
Perfect. That's great. And just before you go, actually, Maya, is there a cap in terms of how many pharmacies that you're looking for in Leicester or around Leicester?
No, that's the great thing, actually. We don't have a cap at the moment. We're really looking to train as many people as we can in this delivery period, so up until July. So anyone that's interested, there's no cap and there's no immediate rush. So yeah, happy to take on everyone.
Yeah, that's fantastic. Thank you so much, Maya and Anna, for joining us, and thank you for that wonderful presentation. And like I said, I'll circulate the slides and I'll circulate the recording. So anyone that's watching back on the recording, if they need access to that email, I'll make sure that it's in the email that's going to be following this recording as well. So, but a special thank you to you both, and thank you to everyone who's joined us this evening. Thank you ever so much.
Thank you.
Thank you so much for joining.
Bye.
Bye-bye.
Bye-bye.
Thank you.
Bye.